know that Orange County Fire Rescue is the largest pre-hospital care provider in the Central Florida area, and they transport over 70,000 patients every year. That is a big number. The health and well-being of every patient is very important, as you can imagine. And we know that fire rescue personnel go to great lengths every day to help safeguard their patients and themselves from infectious diseases. Joining me is Battalion Chief Steve Davis from Orange County Fire Rescue. Thank you all for what you do, first and foremost.
Thank you.
So how do you protect yourselves? You know, there's a lot, everybody's talking about coronavirus now. What do you do to make sure you're safe from getting the call to patient transport?
Well, thank you for having me this morning. It is a pleasure to be here. We start with the 911 system. When a call comes in, that's where we get our first alert and how to protect our personnel. It starts at the 911. Our dispatchers are trained to answer and ask a series of questions before we make it to the scene. And those questions, when they ask them, they give it to us. And when we receive them on our MDCs, our MDCs, our mobile data computers, those allow us to make a judgment on how we're going to assess the situation prior to arriving to the scene.
So much is done before you get there to make sure you're safe. What kind of systems do you have in place?
So we have systems to protect our guys. They wear N95 masks, they have gloves, they have goggles, they have suits and gowns, specially trained to get inside to infectious diseases and contagious environments that protects them before we go in. So we don those equipment before we go in.
Okay, how much training do you have to go through to be able to handle something like a coronavirus?
So this is an ongoing training that we do right now. There's computer training, there is day-to-day training that we do with our EMS captains, with our battalion chiefs, with our lieutenants, just to make awareness for everything that we could be potentially at risk for exposure to.
Are there any additional safeguards that you take when you have a big health crisis like the one we're talking about now?
So we get information bulletins put out through our department, also through the medical director. And those information bulletins help us to identify certain signs and symptoms for crews to be aware of prior to getting to those scenes.
So what I'm hearing is so much of what you do is handled before you even make contact with a patient to not only protect yourself, but everybody around you.
Correct.
Okay.
Correct.
Well, thank you for being with us and for shedding some light on that, because the focus is often on the person who's infected, but rarely do we talk about the risks to the first responders. So thank you for taking us behind the curtain, so to speak. We will be doing more segments like this to keep you updated, not only on news about the coronavirus, but any and everything that we can find to help you have healthy connections.